If you are struggling with weight loss, your doctor may prescribe Xenical to help you. Xenical is used along with a doctor-approved exercise, behavior change, and reduced-calorie diet program to help you lose weight. It is specifically for certain overweight people, such as those who are obese or have weight-related medical problems. Xenical can also help prevent weight regain after you have lost weight. It works by blocking the enzyme that breaks down fats in your diet, causing the undigested fat to pass out of your body in your bowel movement. It's important to note that Xenical does not block the absorption of calories from sugar and other non-fat foods, so you will still need to watch your total calorie intake. Remember to take Xenical as prescribed by your doctor and follow their recommendations for the best results. If you are taking Xenical over the counter, be sure to read all the directions on the package before using it. If your doctor has prescribed Xenical to you, make sure to read the patient information leaflet provided by your pharmacist before starting the medication and each time you get a refill. Take Xenical as directed by your doctor, with liquid, sometime during each meal that contains fat or within 1 hour after the meal, usually 3 times daily. If you miss a meal or your meal contains no fat, skip that dose of the medication. To decrease the chance of unpleasant side effects, it is very important that no more than 30% of the calories in your diet come from fat. Your daily intake of fat, protein, and carbohydrates should be evenly spread over 3 main meals. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. Because Xenical can interfere with the absorption of certain vitamins, fat-soluble vitamins including A, D, E, K, a daily multivitamin supplement containing these nutrients is recommended. Take the multivitamin at least 2 hours before or 2 hours after taking Xenical, such as at bedtime. If you take cyclosporin, take it at least 3 hours before or after Xenical to make sure the full dose of cyclosporin is absorbed into your bloodstream. If you take levothyroxine, take it at least 4 hours before or after Xenical. You should see some weight loss within 2 weeks after you start Xenical. Tell your doctor if your condition does not improve or if it worsens. When taking Xenical, you may experience changes in your bowel function, such as fatty/oily stool, oily spotting, intestinal gas with discharge, and an increased number of bowel movements. It's important to note that these side effects may worsen if you consume more fat than recommended. If you experience these effects, it's important to notify your doctor promptly. If your doctor has prescribed Xenical for you, they have determined that the benefits outweigh the potential side effects. While many people using this medication do not experience serious side effects, it's important to stop taking it and contact your doctor immediately if you experience symptoms of liver disease or kidney stones. Although rare, a serious allergic reaction to Xenical is possible. Seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. It's important to note that the best time to take Xenical is with a meal or up to 1 hour after eating. The recommended daily dosage is 1 capsule 3 times a day. Be sure to follow your doctor's instructions and maintain a healthy, reduced-fat diet while taking Xenical. Before starting Xenical, it's important to talk to your doctor or pharmacist if you have any allergies, as this medication may contain inactive ingredients that can cause allergic reactions. Also, be sure to discuss your medical history with your healthcare provider, especially if you have certain digestive problems, gallbladder issues, underactive thyroid, kidney problems, certain eating disorders, HIV infection, or seizures. If you are diabetic, weight loss may help improve your blood sugar control, but it's important to regularly check your blood sugar levels and discuss the results with your doctor, as they may need to adjust your diabetes medication, exercise program, or diet. It's important to note that Xenical should not be used during pregnancy, as it offers no benefit to pregnant women and may harm an unborn baby. If you become pregnant or think you may be pregnant, be sure to inform your doctor right away. Additionally, it's unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's crucial to communicate with your healthcare provider about any concerns or questions you may have before starting Xenical. When taking Xenical, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's crucial to keep a list of all the medications you are using, including prescription, non-prescription, and herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Xenical include blood thinners like warfarin, HIV medications such as atazanavir, efavirenz, amtricitabine, lopinavir, tenofovir, ritonavir, and triheptanoin. Additionally, if you are taking medications to treat seizures, Xenical may cause these drugs to not work as well. It's important to stop taking Xenical and tell your doctor right away if your seizures are happening more often or are getting worse. As always, it's important to consult with your healthcare provider for personalized advice and recommendations. If someone has taken too much Xenical and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical assistance. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. If Xenical has been prescribed for you, it's important not to share it with others. Your doctor may also schedule lab tests, such as kidney function tests, while you are taking this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. For the best results, Xenical should be used along with a doctor-approved exercise program and diet plan. It's important to consult your doctor or dietitian for help designing an appropriate exercise and food plan for you. If you forget to take a dose of Xenical, take it as soon as you remember unless it has been more than 1 to 2 hours after your meal. In that case, it's best to skip the missed dose because the medication may not work if most of the fat from your meal has already been absorbed. Do not take a double dose to make up for the missed one. It's important to take Xenical as directed for the best results. When storing Xenical, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a place that is out of reach of children and pets. When it comes to disposing of Xenical, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to discard this product when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.